menopause. So we all know by now what menopause is. Maybe some of you have even reached menopause already. So menopause is just one of the junctions along the road of life for us as women. There are different junctions in our reproductive years, and at some point in your life you get to the junction of menopause. In Ghana, the average age is 49, but people can have menopause anywhere from 45 to 55 years. It is natural, it is biological, and for you to have a fair idea when you can expect your menopause, you probably should ask your mom if you are lucky to have her alive, or your mom's sisters. And if your mom had menopause at 55, it is likely that you are going to have your menopause around that age. Sometimes we can have menopause that is medically induced. Maybe for some reason you had a tumor on your ovaries, and so both ovaries have to be taken out. Sometimes it happens to children as young as 12, 15, 20, and they have to have these ovaries taken out. So somebody can be 12 years or 15 years and yet still have medical menopause. There is another angle of menopause where you are not really getting the symptoms, but your womb has been taken out for one reason or the other. And so you are not bleeding anymore, you are not having your periods anymore, but once the ovaries are still there, you have not reached the menopause we are talking about, where you get all of these signs and symptoms related to the drop in your estrogen or progesterone level. So these are the different kinds of menopause we can talk about. So like the person who introduced me, Madam Tamaklo, rightly said, menopause is a three-tiered stage. So there's the first stage, which is the perimenopause. That is more like a transition, and it can last anywhere from 4 to 10 whole years, this transition period. And so you have a couple of years before the actual menopause, where your body starts to feel the effect of the drop in the level of estrogen in your blood. And that is what gives all the problems that we are here to discuss today. And then the moment you go for 12 whole months or one full calendar year, without seeing any period, any bleeding from your vagina, then we say that you have hit menopause. And the moment you have hit that menopause stage, that 12 months, anything after that is post-menopause. And postmenopause is important because although the symptoms of perimenopause may, when you get to postmenopause, which is after menopause, the symptoms of the perimenopause will get better and eventually disappear. But at this stage, you are also at increased risk of various health conditions like osteoporosis and heart disease. And so you need to really watch out for some of these things. I think we've mentioned the causes of menopause, so I'll skip that. So what is normal? We've discussed quite a lot of them. So please, when we get to the discussion part, I would want people to tell us what their experiences have been, what you have seen, all the things you've talked about, what you are experiencing. And if you have any coping mechanisms that would help the house, you can share with us. I am 43. Fortunately for me, I have not started, maybe apart from my hair thinning a little bit, I have not really seen any signs. So I may not have a lot to share in terms of personal experiences, but I look up to the audience. And so around perimenopause, one of the things that can happen is that your hair starts to thin. And so it's not as heavy as it used to be when you're in your 30s or 40s. When you draw a line in between your hair and part it, you realize that you see more space, like you are seeing in the picture. Sometimes when you comb your hair, you actually see strands of hair in the comb, and it becomes worse as perimenopause progresses. Other times you may start to feel a lot of joint pain and stiffness, and this is all related to the reduced amount of estrogen in your system. The hot flashes, it is one of the things that is of a big concern to almost every woman going through the perimenopause. And although it is a natural or biological thing because of the effect of the reduced estrogen, there are a lot of things that we have come to know can trigger or make your hot flashes worse. And some of the triggers we have listed below, any situation that puts you under stress or makes you anxious would make you more likely to get hot flashes or make it worse. When you take hot drinks like caffeine or drinks that contain alcohol, it makes the hot flashes worse. If you eat food that is very spicy, we Africans there, we like pepper. So the more pepper you eat, the worse your hot flashes will be and the more frequent they would come. And then of course, hot weather, overheated rooms, or when you wear very tight fitting clothes. Sometimes you are wearing a lot of layers and there's a lot of heat in Ghana. I don't know, nowadays the sun is unrelenting and merciless in Accra and Kaswa. And then for a few people who smoke, smoking would also make your hot flashes worse. It is important to note these triggers because in the management of the symptoms of perimenopause and menopause, one of the key areas is for you to identify the triggers and avoid them or eliminate them. Okay, so in terms of the management, we'll talk more about it later on. But commonly, we have hormone replacement therapy. I'll discuss that in detail. And then we have cognitive behavior therapy, which is more like a clinical psychological way of dealing with the symptoms of menopause and perimenopause. More importantly, there are a lot of lifestyle changes that would help us to navigate this area more easily, including stopping smoking if we are overweight, managing our weight, and then reducing our alcohol and caffeine intake. In terms of lifestyle modification, one of the things you can do that helps a lot is to dress in layers, so that if at any point the hot flash comes on and it is really bad, you can take off your jacket or whatever you are wearing on top and have a more lighter dress beneath what you are wearing, so that you cool off very easily. And then it is better to wear clothes that are made with natural fabrics like cotton rather than the synthetic fabrics that make you sweat more. And when all of these have been put in place, the other thing you do is that you find yourself a portable fan and then you put it in your purse. So there are two different pictures of two different fans here. A lot of the one or both of these come from China, so you can get one or two of these, keep them in your car, keep them in your purse. We'll do baby. Today I went to church, I was feeling so hot and I was wishing that I had my fan with me. I've made a mental note that I'll just carry one of these in my purse. When I'm feeling too hot, you just take it out and then you fan yourself. One of the other things that can be really, really disturbing, and when I was reading this, I really had a lot of memories about my mom. I remember her going through perimenopause and menopause. I was a bit too young to understand, but I remember so well that suddenly you had to tiptoe around my mom because you never know what you are going to say that is going to take her off. And she was always irritable, she was anxious. One minute she's happy and laughing with you, the next minute she's flinging a big book across the room to hit you. And it was really hard to deal with her. And I realized now in retrospect that she was going through menopause. A lot of sudden mood swings. Sometimes you feel depressed, you feel like your energy levels are low, you are wondering how you are going to be able to go through your day. And for those of you who have premenstrual syndrome, for some of us before our period, we have some physical symptoms including bloating, a change in libido, some people have very sore breasts, some people have headache, and all of these things for people who have PMS can get worse as they get towards the menopause. And all these things we are talking about, we trace all of them back to the fluctuating and reduced level of estrogen and progesterone in the blood. And for some people, there's breast tenderness, there's fatigue, There's food cravings. It's like they are pregnant. There are some food they don't want to eat, some food they are craving for, and it becomes very difficult for them to fall asleep and to stay asleep. And some people get to the point where they are socially withdrawn. They may have been the partying type, like they let them, suddenly they don't want to go to any party. They just want to stay home and stay in their couch and probably read a book. The sleep disturbances are a symptom on their own because of the perimenopause, but more importantly, because of night sweats and the kind of environment we find ourselves in. These night sweats can happen at night as well, and they make it difficult for you to fall asleep or to stay asleep. Sometimes you may have fallen asleep, but the night sweat and the hot flashes will wake you up, and it will be difficult for you to fall asleep. It is important to do everything to fight this, because if you are not sleeping well, it makes the night sweat and all the anxiety and the mood swings worse, and then it becomes a vicious cycle. So anything you can do to make your sleep better, you do it. One of the things we recommend is that just before bedtime, don't engage in anything that is stimulating. For example, don't go to the gym in the night just before you come to sleep. Don't drink coffee. Don't have a conversation with your spouse about something that is emotionally charged. Don't allow your children to upset you. If something upsetting comes up close to bedtime, tell yourself that this can wait till morning, because the moment you tackle it, it is going to affect how your sleep goes through the night. You really need to make sleep a priority, like make it World Cup, and if possible, have a set time that you go to bed. Let your bedroom be that place which is mainly for sleeping. Me, I'm guilty. My bedroom, my laptop is there. Sometimes my breakfast is by my bed, and I do everything here in my bedroom. But if you are the kind of person who is having issues with sleeping, then make your bedroom that place that is for sleeping, and do everything else outside the bedroom. And so when you come into the bedroom, you take a cold shower just before bed to help you to cool your body down. You keep the bedroom dark, cool, and very quiet. If you are somebody who likes to sleep with music, have some very soothing music in the background. If you can afford it, have an air conditioner in your bedroom, so that, like right now I'm having this presentation, I always get very hot when I'm having a presentation, so the air conditioner is on to cool me down. If you are that person who likes social media a lot, make sure that the time you come to bed, you ditch your smartphone far away from you. It should be far away so that you cannot reach out for it. And exercise daily. When you exercise during the day, some way, somehow, by the time it is bedtime, your body feels more tired and you sleep easily. There are times when you have changes in your vagina, forgive my French, and then in your sexual behavior because of the perimenopause. And all of this is largely because the estrogen levels have gone so low that your vagina is dry and not as lubricated as it was when you were in your earlier years. And because of the dryness in the vagina, even when you are having sex and the foreplay is not extensive or prolonged, bearing in mind that you are at a different phase in your life, sex becomes painful and uncomfortable. And that is the reason why the libido of a lot of women would dip at this point, and they would not want to have sex, not because they don't like the sex, but it is too painful and too uncomfortable. Sometimes some women, much to the amusement and to the joy of their husbands, at this stage in the perimenopause, they tend to get an increase in their libido. And that one, the men do not complain about. And if you are lucky to be one of those, then please, by all means, have your fun. So when it comes to the vaginal dryness, it may cause you to start having vaginal itching. Sometimes you have light bleeding after sexual intercourse. You may feel soreness in the vaginal area, and because your skin is breaking easily and there's more friction during sex, you tend to get recurrent urinary tract infections, and with it comes the urge for you to pee more frequently. How do you manage this kind of vaginal dryness? So we have vaginal lubricants, okay, which you can use just before sex. First of all, you can speak to your partner about it. Let them understand the phase in life where you are at and how it is affecting you sexually, so that they take their time and do a little bit of more foreplay before penetrative sex. You can also get over-the-counter lubricants. The commonest one in our environment is KY jelly. So you get it and then you do a lot of lubrication before sex. They have vaginal moisturizers, they have estrogen creams that you can apply locally before you have sex. And then of course there's hormone replacement therapy, which we are going to talk about a little further down the road. We mentioned the libido thing. So you talk to your partner, lubricate, and then you do your pelvic floor exercises, the Kegels. It's very important. And you also really need to prioritize your mental health, because with all of these symptoms, a lot of women dip into depression and they tend to have a very low self-image. They feel they are not as desirable as they were before. Sometimes there is weight gain, and so your belly starts getting bigger. And when you look at yourself in the mirror, you don't feel beautiful. And the way you feel about yourself really goes a long way to affect the way you show up in the bedroom. Sometimes you don't even want the light to be on. You want your partner to have the light off all the time. That kind of thing. And so it is really important to look at the mental health aspect of your total well-being. One of the things that is really bothersome during the perimenopause is irregular periods that will skip a beat. So sometimes the period will come in January, February, it will not come, then it will come in March, it will come April, May, then June it will come. It's so irregular, erratic. You don't know when your period is going to come. There are other times when it is more frequent, and so you've had your period in January, you are expecting the next one in February, but by latter part of January you bleed again. So you are either bleeding too short intervals or too long an interval, and sometimes your period tends to become more heavier than they were before. A few people will have lighter periods, but most people tend to have heavier periods, and then sometimes you spot in between. And this transition is really, really hard for a lot of women. One of the ways you can manage this particular era in your life is to just keep a pad or tampon somewhere in your bag or in your car all the time, so that anytime the period catches you unawares, you are ready for it. So your gynecologist may help you to manage the irregular periods by giving you combined oral contraceptive pills. Sometimes the hormone replacement therapy would also regularize your period. I mentioned weight gain in passing. So around this period, because your estrogen levels are so low, estrogen is very important for metabolism. So once it becomes lower, your body's metabolism slows down, and it takes a lot of us a while to get to that place where we are reducing how much we are eating. Okay, so in the period, that lag phase where you are still eating your regular quantities, you are accumulating more fat, and it tends to settle a lot around our belly areas as women, especially for those of us who have had children before. The fat just settles in your midsection, and you find your tummy growing bigger and bigger, and this one can also affect your self-image a lot. Averagely, you gain about 1.5 kilograms per year during this transition period if you do not do anything about it. sometimes you get what we call brain fog. Like what brain, it is slow, it doesn't think as quick as it used to think before. You remain unfocused. It is really hard for you to focus on whatever you are doing, and you have trouble focusing on an assignment that has been given to you. Sometimes you're even having a conversation with your friends, and it is hard for you to even remember what you are going to say, or you are reading a novel or anything, and it is really, really hard for you to follow what you are reading. You may tend to start having memory lapses. And because sometimes you walk into a room to pick something, and for 5 minutes you are standing there and you are asking yourself, like you've totally forgotten why you came. Then you go back out to your car before you remember why you went to the room, and you have to come back to get it. Sometimes you may have had appointments with your friends, and if you don't write it down or set a reminder on your phone, you totally forget that there was something that you needed to do. Sometimes you just get these mental blocks where in the middle of a sentence you have totally lost your train of thought and you've forgotten where you are what you are going to say. And in your earlier years, it may have been very easy for you to do a lot of things at the same time, but you realize that now you can hardly do more than one thing at a time. It is important for you to, yes, that is a picture of me in case you are wondering. It is important for you to note that during the perimenopause, so long as you've not had absent period for 12 months, there is that possibility of you becoming pregnant. And so if you are not ready to have a pension baby, even during the perimenopause, you should have contraception in place. Otherwise, you wake up at 51 one fine morning, and then you test and you have the shock of your life, like the way I'm shocked in this picture. So what is normal at menopause? What is normal is that you've not had your period for at least 12 months. That is normal. And at this stage, your estrogen levels are low, but they become more consistent, okay? So your symptoms become less and less, and if you are lucky, it will totally disappear. Then we mentioned the libido thing. It either goes up or comes down, but it is something to expect at menopause. What is not normal? When you are bleeding extremely heavily, such that you soak through a pad or a tampon every 1 to 2 hours. That kind of bleeding is too much, and you need to see your doctor. Anytime you bleed after sex, whether it is spotting or heavy bleeding, please see your doctor. If you have not had your menses for 12 whole months, and then after that you bleed, it doesn't matter, even if it is just spotting, you need to see your doctor. If you are bleeding in between periods, or if your period is too frequent, they are coming in at shorter intervals, less than 21 days apart, that is one too many. You need to speak to your doctor. And if you have periods that are lasting very long, more than 7 days, some people will say 10 days, but in a lot of literature, you should not bleed for more than 7 days. And if you start experiencing these symptoms of menopause before 40 years, you need to have your doctor examine you. Some people can have menopause before 45. We call that early menopause. You need to see your doctor for him to make sure that everything is okay. So we move on to talk a little bit more about the options we have for management. So the first one we'll talk about is the menopausal hormonal therapy. So this is basically medication that contains a mixture of hormones, usually estrogen and a bit of progesterone. Sometimes it contains testosterone as well. And we use this to medically manage the symptoms of menopause. Symptoms of menopause are natural. We don't normally manage them, but we would want to manage it when the symptoms are so bad Listen, no, they are so bad that they interfere with your daily life and you are not able to function, whether as a worker, whether as a wife, whether as a mother, whatever makes you, whatever makes your life. If the symptoms are interfering with that life of yours, that is when there is an indication for menopausal hormonal therapy. And it is available in different doses and different forms. Sometimes you can take it as a pill. Sometimes there are patches that you just put somewhere on your body. There are gels, there are vaginal creams. There are even some that are like IUD that you put in your womb and then they release the hormones slowly. So your doctor would always have this conversation with you, run some labs, go over your medical history, your surgical history, before he can decide if you are a candidate for menopausal hormonal therapy. Of course, like every kind of medication, especially because it is hormonal, there are a few side effects that can come up. You may have a bit of nausea. Sometimes it will give you starved breast. You would have fluid retention, so you start having, your face is puffy. You may start having edema at your feet or at your ankle, and sometimes you may have vaginal bleeding. The problem that you are trying to solve, sometimes the medication will bring you that same problem. These side effects are very common most of the time, the first 3 months of therapy. After that, it becomes stable and then your life is good. Bear in mind that if you have certain cancers, particularly breast cancer and certain forms of uterine cancer, you are not a candidate for menopausal hormonal therapy, because some of these cancers that we are talking about, they feed on hormones to grow. So once you are feeding your body hormones, it means that you are giving your body a chance to grow these cancers back. And then also, you may not even be already have cancer, but once you are taking hormonal replacement for management of menopause symptoms, you are feeding your body hormones that can generate cancers. For example, endometrial cancer, if you are not menstruating anymore, your chances are less. But the moment you are taking in exogenous hormones like this MHC we are talking about, it predisposes you to endometrial cancer, and so it has its own side effects, and the decision to use it or not is a very fine balance between the benefits and then the disadvantages. There are lots of non-hormonal therapies which would normally be our first line of therapy for people who come in complaining of menopause symptoms. A lot of the time, what you need to do is to modify your diet and your lifestyle. So in terms of lifestyle, exercise more, try and lose weight, join support group. This is our first support group. We are going to have a bit of discussion as to how everybody is coping, if you have any coping mechanisms. And then you may need to avoid the triggers that bring on the hot flashes. We've talked about them earlier on. Look at what you are drinking and what you are eating. And then there are certain foods that are plant-based food that are quite rich in estrogen, like soybeans, chickpeas, lentil, flax seeds, grains, beans, gobe. Gobe is good for you. Fruits and vegetables. So you need to increase those ones in your diet, and they'll go a long way to help. So the other treatment for menopausal symptoms, notable among them that I want to talk about now. Sometimes some women, the mental part of their menstrual perimenopausal symptoms, the depression and the agitation and the mood swings are so bad that they may need to see a psychiatrist and they may need to be put on antidepressants. Sometimes we give anti-epilepsy medications, and these help to manage some of these very extreme cognitive side effects of menopause. And then we have cognitive behavioral therapy. These are normally done by the clinical psychologist. It's basically you trying to look at your symptoms from another lenses. Okay, so you have perimenopausal symptoms, hot flashes, night sweats, all of those ones, and they are preventing you from having a good night's sleep. So you go to bed, you are worried, you are anticipating that you will not be able to sleep well. So you wake up in the morning, you are not rested, you are tired, you are stressed out, you are anxious, you are in a low mood, and that makes your symptoms even worse. So you start this vicious cycle. And how do you break it? By changing the way you think about your symptoms. So perimenopausal symptoms are like any of the symptoms that, are like any of the problems that we all have in our lives. I know that as human beings, at any point in our lives, we are carrying one burden or the other. It may be an issue with your children, it may be with your spouse, it may be with work, it may be with your father. All the time, there is something that affects you in a certain way. But just like the way you try and put that burden aside and then develop a positive attitude towards it and decide that I'm not going to let this thing affect my life. It is not going to steal my joy. It is not going to stop me from enjoying all the other good things in my life. That is basically what the cognitive behavioral therapy is about. So you are changing the way you look at the situation. And then we also add things like meditation, deep breathing exercises. Sometimes they'll talk to you, work you through how to manage your mood so that you are not so depressed. So it is purely a psychological way of managing the symptoms of menopause. And if you want to go that way, I sent a document to Della about it. There's a lot of information online. You can actually decide to treat your own self, but you can also opt to see a clinical psychologist if your symptoms are very intense.